How's that feel, Bella?
Good.
Perfect. Hey everybody, this is Mike with Kalkstein Chiropractic, and we've got Isabella here down on the table. So today we're going to be doing another video on our Shockwave, our new favorite toy. So what we're going to be doing is just the top of the shoulder here. We're going to be hitting it bilaterally, so on each side. Bella's been experiencing just a little bit of discomfort, a little bit of pain in the shoulder blades. So we're just going to kind of help her body jumpstart that healing process and ultimately, work out whatever she's got going on in there. So this isn't the Shockwave just yet. This is just some vibration therapy. Feels no different than like a massage gun, but it helps us to get the ultrasound gel spread around. We want to make sure that we have whatever area that we're doing with the Shockwave nice and covered in gel. Now unfortunately, Bella is going to get a little bit of gel on her shirt here, but it's just the price she has to pay for good healing. So we're going to go ahead and start up the Shockwave on this side. Now Bella's never had the Shockwave done to her before, so we're going to have to start it off pretty low just so she can get used to the pressure. I've got our red tip here on. It's about our medium tip. It gets pretty deep, but not as deep as our other ones do. This one being the gold, being the deepest. So let's go ahead and start it up. Bella, how's that feel? Not bad? Not bad at all. Perfect. So I'm going to go ahead and turn it up. What do you think we're at pressure-wise on a scale of 1 to 10?
Like a 5.
5? Perfect. So would you say we're at about a 6 right now?
Yeah.
Alright. So we want to typically sit at about a 6 out of 10 on pressure, because if we start finding any trigger points in here, those are really going to get that pressure to jump up. We don't want to end up hurting the patient or hurting our own staff member when we're doing any sort of treatment. We don't want to go over top of any bone, so we're just sitting right here in the muscle. We can even go a little bit lower, but again, we only really, see, we just found a good spot there. We only want to go to spots that have gel on them though, and that's really important. So always apply extra gel. You can always just take a towel and wipe it off, but if it starts feeling like there's rubber bands kind of snapping against the skin, then you don't have enough gel on the skin itself. And that's just going to lead to discomfort during the treatment. How's that feel, Bella?
Good.
Perfect. Got a spot right there? Alright. Right as I was saying it, we found a good one. And so it's harder to tell because Bella has her face down, but you always want to look for, a little flinching or anybody trying to grimace and make a face. That's when we've gotten a good spot to sit on here. Now what we're doing is we're coming in and using acoustic sound waves to basically cause micro traumas on the muscle itself to kind of jumpstart the healing process, and any cells in the muscle that are dying off or are weak or really just have no reason to be there anymore, we're going to actually kill those off, so that way the body can go ahead and start the healing a little bit faster and start getting some new fresh cells into that muscle. And so we've got about 300 pulses left on this side. We only typically want to do about 2,000 per muscle group. Don't need to do more to get a nice therapeutic dosage in on this. You can even tell in certain areas the skin's starting to get a little bit more red, and that just makes me hit that area nice. And that's the one side. So we're going to load it up again and we'll do the other side. I've just got to put some more gel on now.
It's nicer than I thought it was going to be.
Alright, let me get the vibration going again.
I thought it was going to hurt, but it doesn't.
No, it doesn't hurt too bad unless you have a really troublesome spot, and then it'll scream at you a little bit. Yep, round 2. I'm going to go ahead and start it a little higher. Not quite up to where you were on the other side, but just high enough so we don't have to be all the way lowered, okay?
Mm-hmm.
How's that feel?
Feels good.
About a 4 maybe? 4 out of 10?
I think a 3.
Perfect. So we're going to go ahead and turn that up a little. Is that about a 6?
Not quite.
So this side isn't as bad as the other side.
There we go.
There it is. So the same thing, we're just going to kind of work around all of the bones. Don't want to go over top of the bone because that's just going to end up being very, very, very uncomfortable. That 6 out of 10 pressure will instantly jump to a 10 out of 10 and just ultimately not be what we're looking for. Oh, is that a spot right there? And so the nice thing about this as opposed to some of our other modalities is it's actually designed to be able to sit on trigger points. Whereas, you know, if we took the laser and then we sat on one spot with the laser, it would end up leading to the skin being burned, which obviously we don't want. How does that feel right there? Halfway down. Probably about another 30 seconds, maybe a little less than that. And we'll be off Shockwave. So it's pretty normal for the first day, or even, 2 days after your Shockwave to be feeling really good. And then if your shoulders feel a little bit sore, a little bit more painful than they did originally, that's totally normal just because we were beating up all of those cells in that muscle itself. But that is our Shockwave. We went ahead and did 2 doses on each side, nice 2,000 pulses per. Like I said, we typically want about 2,000 pulses to be a nice therapeutic dosage. So Bella just got her first Shockwave experience here.
How'd it go?
Excellent. It's excellent.
All right, everybody. Well, thanks for tuning in for another video. We'll see you next time.